The National Health Insurance Bill has passed another hurdle on its way to becoming law. After being passed by the National Assembly, it was passed by the National Council of Provinces earlier this week. The Health Minister says it will be implemented in stages once it gets the nod from the President. Now, most stakeholders laud the idea behind a National Health Insurance, or NHI, which is to provide access to quality healthcare services for all, not just those who can afford to pay for private doctors or private cover. But various bodies like the South African Medical Association have said that the bill is unaffordable and unfeasible in its current form. To discuss, we're joined by Professor Alex van den Heever from the Wits Social Security Systems Administration and Management Studies. Prof, thank you for being with us as always. It's very hard to argue against universal health care. Surely we should all want that. But can this bill, in its current form, make that ideal a workable reality?
Yes, so universal health coverage is a coherent objective, but the universal health coverage doesn't necessarily mean that you prohibit people from covering themselves if they wish to. The idea behind this bill is that it's going to create one system for everybody, and everybody will have to fit into it. That hasn't been done anywhere in the world. It's not feasible in a developing country, and it's an incoherent proposal, and it's not really consistent with the principles of equity and coherent institutional design. So it's just not going to happen, and it's not going to happen because somebody has passed a bill. And it's also not going to happen, and I think they're perfectly aware that it's not going to happen, which is why the argument is, no, your grandchildren are only going to be the ones who benefit from this. And really that is a sop to what is in essence a rather vacuous political proposal instead of a really intelligent, well worked out social policy, which is what we need.
Can we just tease out a little bit what you've said? So say you are an executive, you're very busy, you can afford cover, and you want private healthcare, you need your gallbladder taken out. If that is covered by the NHI, as I understand it, you will not be able to go to private service providers. You will have to work within the system. So do you agree with those saying that undermines the right that you have to choose your healthcare, and it's unconstitutional?
Yes, it is unconstitutional. It does undermine people's rights to access healthcare as they wish. There is nothing inherently wrong in somebody purchasing their own healthcare and their own coverage at the level at which they want to, so long as it doesn't undermine anybody else's access to healthcare that's affordable through subsidized methods, so the tax system, for instance. So we do this for education, we do this for housing. There is no framework that we've implemented anywhere in South Africa that says because we have a state police force that you're not allowed to buy your own private security. So this is the logic that is applied in the NHI proposals themselves, an extreme version of a health system which is impossible to implement. So, but it implies equality of access to healthcare based on whatever the tax system can afford to purchase. It's just not going to happen. And but part of the framework, and it's understood that it won't happen, which is why they actually seek to prohibit somebody from being able to access their own cover. They implement a law to stop you from purchasing your own care in order to establish a state monopoly. And that makes no sense. It is illogical because there is no harm that is created by somebody who purchases their own healthcare. There is none. So there is no zero-sum game. For our health services in South Africa, you're always going to have whatever the state can purchase. What they're saying is, no, everybody's only going to have whatever the state can purchase.
Isn't the idea, trying to play devil's advocate, to get the excellence that's currently held in the private sector to be included in the system? So it brings everybody into one net, as it were. Of course, that is one of the arguments made against it, that is becoming a disincentive to private doctors, to people, to specialists who may be thinking of leaving the country because their salaries will be capped as well. Is that envisaged in the current system?
Yeah, it's an absurd proposition. The idea that, for instance, let's say an Eskom is going to be the efficient purchaser of all of our energy requirements and distribute it to everybody, and therefore we will prohibit anybody else from providing energy. But and that is in a way to get all the excellence around South Africa in the provision of energy into Eskom. Well, we've seen that work out. It doesn't work out in a system that is actually far simpler to administer and manage, an energy system, than healthcare. You're not going to buy the private healthcare and the excellence in the private healthcare by forcing it into a straitjacket. That just doesn't happen. It is a false proposition. It is not tested by any evidence or information. It's also not tested against any other environment where this has happened. We are going to have a private system. We're always going to have a private system. There is no way in which you can prohibit people from purchasing their own healthcare, and it obviously will be strongly opposed. Parts of the bill that attempt to do that are quite plainly nonsense, but that's quite aside from the parts of the bill that also deal with attempts to circumvent the allocation of concurrent powers to provinces to provide healthcare. This attempts to centralize healthcare and run it as a state-run service from the national level of government, circumventing the provincial powers to provide healthcare without changing the constitution. So that's also a further infringement of the constitutional framework.
You said that they know it's unimplementable. Presumably you mean government. Why then is this being pushed through? That would suggest something very cynical or political going on.
Yeah, look, pushing through things that can't be done is hardly something unusual in South Africa. Why I say that they are perfectly aware that it can't be done is that there's been no financial feasibility report produced. For over 15 years, there's been a promise that, in fact, the National Treasury will produce some kind of financial feasibility analysis. They failed to do so. The National Department of Health has failed to provide any kind of coherent institutional or financial appraisal of their proposals, nor have they provided any factual basis for the kinds of proposals they're making. They haven't done any international comparative analysis that's truthful. They've compared countries that they've stated in various documents that don't look anything like what is being proposed in South Africa. And the reason why I say that they're being dishonest in this proposal is because if you were honest, you'd be able to produce the evidence. But the mere fact that they don't shows that they are aware of the fact that there are fundamental flaws in these proposals and they don't want to make them obvious.
Final question. I mean, wouldn't the obvious place to start be augmenting what we currently have, which is a public service, which essentially should provide, if it worked correctly, quality healthcare to poor people who can't afford that private cover anyway. So fix what we've got, or fix the wheel rather than reinvent the wheel in its entirety.
Well, so if we had to look at the state system, the public health system, we have 8 provinces working extremely badly and one that's actually working quite well within the financial constraints that it has. That difference is embarrassing because that is in essence showing up the ruling party's inability to actually provide healthcare within the current institutional framework. And it's saying because we failed to be able to provide this healthcare, we're now going to completely change the entire system and also rip the only province that's working into our system. So that's part of the problem. It's very political. Now, in terms of correcting what's wrong in the public sector, it can be through coherent governance reforms that separate the executive of government from the administration of the health services. This is well understood as a way to get health services to perform well. You decentralize them, put them under accountability frameworks that report effectively to communities and downward. And in the private sector, the regulatory framework has been established by the Health Market Inquiry, which has been completely ignored, but is a substantive report produced over 5 years with a diagnostic analysis and a set of detailed recommendations. These recommendations are far more sophisticated than the frameworks discussed in the National Health Insurance Bill. So part of incrementally changing our system at the moment requires that we engage with the serious challenges that we have in our health system and make the incremental adjustments that will make them work. There's nothing inherently wrong with the architecture of our health system. What's wrong is the detail of the accountability systems that we have in place, which make the system, render the system unsustainable. And the public system is failing dramatically and will not change with this bill. And I think a part of it is there is no intention to change it, because this bill, I would argue, is largely a distraction from the failure to actually make the kind of reforms we need and implement those reforms.
All right, a very harsh critique. Thank you for your time. Wits Social Security Systems Administration and Management Studies Professor Alex van den Heever.